building a better Bay Area. Moving forward, finding solutions. This is ABC 7 News.
Hi there, I'm Kristen Z. You're watching Getting Answers live on ABC 7, Hulu Live, and wherever you stream. We ask experts your questions every day at 3 to get answers for you in real time. Today, we'll tackle what happens if your school decides to do temporary distance learning. Will those days have to be made up? Will the school districts lose much needed state funding? Is independent study an option for your student? San Mateo County School Superintendent will be joining us live. But first, the CDC in the past hour updated its mask guidance amid the national Omicron surge. So here are the key elements. Cloth masks provide the least protection. It's okay to buy N95 masks, and fit is key. Joining us to discuss this new development and answer your questions is ABC 7 special correspondent Dr. Alok Patel. Dr. Patel, happy Friday. Good to see you.
Happy Friday to you, Kristen. It is good to see you as well, even if it's still in this digital dystopian reality.
It really is. I know we're all tired of it, but nonetheless, and I know you have both a personal story to tell us and also two truths and a lie for us, but I want to start with the CDC mask guidance because that just came down. Those three things that we listed about cloth being the least effective, about it's okay now to buy N95s and not have to feel like you have to save them for, healthcare workers, and the fact that a good fit is most important. We knew all those things, didn't we? Like, what about this is new?
Nothing, Kristen. We did know these things. It's nice to see the CDC finally come down and say, here's where it's at. It just feels very delayed. And public health experts, even the White House has been saying this for a lot longer. I think what's important for people to know out there is that Omicron is behaving in a little bit of a different way than previous variants. And so the only real update now that is still a little bit late is that cloth masks just aren't the optimal protection, and mask fit plus material, in other words, filtration, is really what people want to be going for. So gold standard is at N95, KN95, or KF94. That's
right. All right, folks. So in case you're wondering, this is not as good as this, okay? And of course, an N95 is better, which I don't have with me. But Dr. Patel, it's interesting that the CDC does not actually tell or suggest which mask to wear in different situations.
It doesn't, and I think that would be a little cumbersome, if you will, for people out there to try to weed through that. I think just giving people the baseline information, saying that fit filtration is the most important, is really key because people are getting confused. I do wish the CDC would have done this earlier with their exposure and isolation guidelines and saying hey, you want to make sure you're wearing a mask after you have 5 days of no symptoms, but make sure it's a high quality mask, because we do know that even if people don't have symptoms, they can still shed some virus. And so making sure you have that optimal fitting mask is really key, especially since a lot of people can't go out there and get tested. So that's what I've been advising a lot of people is, if when in doubt, just wear one of those masks.
That's right. Real quickly, how long can you wear an N95? I read somewhere 40 hours. Do you have thoughts on this?
I don't know if there's any scientific study about if you wear an N95, what is the time when it starts to break down. What people want to understand, though, is that if your mask gets damaged anyway, or the strap starts to break, it gets loose, you're starting to lose effectivity of that mask. If it gets wet or dirty, that's also a time for you to say, hey, I should probably replace this. You can't really clean a mask. You can't get it wet. You can't use soap and water. But one little trick that some people do is when you come home, make sure you're not touching the outside of your mask. Take that mask off and put it inside of a paper bag or put it in a dark place and let it sit there without moisture for a couple days, because if there's any virus on that, it's probably going to die after a certain amount of time. But a lot of people out there can safely wear their masks for an entire week.
Got it. All right, no need to specially sanitize it somehow. Just leave it there in that bag. Don't touch it for 2 days. Let the virus die. Okay, and with that, I want to share with you, Dr. Patel. Erica says, yay, Dr. Patel. Suzanne says, I like it when he's on, too. He's an excellent communicator. I bet they are fans of Two Truths and a Lie.
I bet they are, and I bet they're really good at it as well. And I don't know, today might be hard, might be easy, but you may need their help, Kristen.
All right, I certainly will, so bring it on.
Let's rock and roll. Okay, so round one, everyone knows the drill. Tell me which one of these is not true. Is it A, deaths are up 40% from last week, and the CDC believes that these are mostly from Delta? Or is it B, a study from Southern California shows Omicron infections are 74% less likely to result in an ICU stay than Delta? Or is it C, wastewater studies in Gilroy, Palo Alto, Sunnyvale, and Santa Cruz suggest Omicron is past its peak? Which one of these is not true? yes, I'm getting tricky.
You certainly are. And if you're watching us on Facebook Live, I'm going to give you a few seconds to provide your answers and help me out here, audience. Vivian is already saying A. That is what I'm leaning, because I think B is true. And I think I read C. Definitely they found that in the New York area, and I believe also in the South Bay. So I'm going to go with A. Erica agrees with A, and she's very well read, although we do have a few B's and C's too. But let's go with A is the lie.
So A is actually true.
Oh.
And this was a statement that CDC Director Walensky came out, and this reflects the two realities. Kristen, is number one is that death rates are actually going to lag what we're reporting in terms of case rates and hospitalization rates. It lags all of it. And also, Delta is not only still out there, it is the minority variant right now, but it's still the deadly one. And so that was just kind of a reality check for people out there to realize, like, hey, these numbers are lagging. B is true, and B is obviously good news. We've anecdotally reported this. There's been data out of the UK and South Africa that Omicron is more mild. This is a big study from Southern California. And C, yes, I was mean. I was tricky. C is mostly true, except it's not Santa Cruz, it's San Jose.
Oh my goodness. See, okay. Can I just give a shout out to, you should apologize to all of us who answered A, and that's most people in this round. But Viet and Karen, congratulations on saying C. You understand how Dr. Patel's evil mind works. So there you go. No, actually, that was great. I'm glad you tested us on that. Very important information there. Let's talk about tests, Dr. Patel, because starting tomorrow, Americans can get free COVID tests. Insurance will have to cover up to, I think, 8 kits per person per month. Exactly how does this work? A lot of people are wondering, so what, do I just order it? Do I save the receipt? How long does it take before I get it? Walk us through that process.
I wish I could, Kristen. I wish I could clearly walk you through this process and tell everyone out there, this is where you go to get free tests. But guess what? It hasn't really been clearly outlined. There is a website that is supposed to be being launched next week. I believe it's something like COVID-19 tests.com or .gov, but don't quote me on that. But there's been a lot of frustration. There isn't a transparent plan.
COVIDtest.gov, yeah.
And I hope that this website runs as seamlessly as what is being touted. The one thing that does kind of bother me is there was a statement, there was pushback from insurers, actually today reported by the New York Times, and insurers stating that, hey, Saturday is not soon enough for us to be able to reimburse these tests. And insurance companies are saying they need several weeks to work this out. That sounds like a delay, in my personal opinion, because if you don't pay a hospital bill, it's not a few weeks before an insurance company contacts you. It's right away. And so I do think that this is a little bit of a failure in terms of getting ahead of it. We need those tests literally right now, because these surges are happening right now. And I don't understand why they're not just being mailed away for free immediately, or we don't have them readily accessible, because they are very hard to get.
Yeah, and that COVIDtest.gov website that will be live as of next Wednesday that you were talking about, I think they're warning people that they'll ship within 7 to 12 days. Ship within 7 to 12 days, and then maybe add another 5 days for shipping. I guess what I'm asking you is, look, if a lot of people won't get their test kit until like end of January, early February, won't the Omicron surge possibly be over by then?
It's possible. I don't know if the surge per se would be over. I'm hesitant to use that terminology, but we might be past its peak, which is also important. But Kristen, that's why in the meantime, it's important that we're revisiting this conversation about distancing, staying home if you don't feel well, and wearing a good fitting mask, and also getting vaccinated. And, these are the cornerstones of what people can do to protect themselves. If you can't access a test, a lot of people can go and find a test if they try hard enough, if they have the resources when they're initially symptomatic. But not everyone is able to get multiple tests in order to test negative to be sure that they're not contagious, or be able to return back to work. And this is a big issue right now. And this is what was keeping a lot of teachers, a lot of healthcare professionals, and other frontline workers out of work, out of the ability to test negative.
Well, in fact, Dr. Patel, you experienced testing woes yourself, which if folks join us on Facebook Live while we take a short commercial break, you'll hear that story exclusively. And when we come back, another round of Two Truths and Live. We'll be right back.
Exclusively.
I know, it's a bonus for our Facebook Live viewers. So here we are hanging out during commercial on Facebook Live still. So you viewers get to hear, how even a healthcare professional, Dr. Alok Patel, had a tough time getting a test and a test result. Tell us what happened.
So I was symptomatic, pretty telltale symptomatic last week, and it was actually worsening over the weekend. I had a known exposure prior to that. And, you know, I have an unvaccinated 8-month-old baby girl who misses being on camera with you, Kristen, by the way. My wife was also symptomatic. And, you know, we went to all the local pharmacies around us and we couldn't find tests. We asked around at a local Walgreens and they said, hey, there's a shipment coming this upcoming Wednesday. And I'm going to be completely honest, I actually felt guilty about trying to run around and buying up tests from all the Walgreens. I literally felt guilty when I saw a small supply there. So I bought the max for one person just from one store. And also $25 for a Binax test and times 4, that is not attainable by a lot of people out there who are trying to test every member of their family. So I finally got a couple tests. And you know what? My rapid antigen tests were actually coming back negative, which was surprising to me given the exposure and how sick I felt. And so I wanted to get a PCR, the gold standard, to really know. I had to go through my physician. I had Kaiser insurance. The only test available soon was in South San Francisco. I drove down there. I waited an hour. I got the test result. I got the result back 3 days later. It was negative, I was happy about that. I was also a little surprised. But if you look at the entire timeline, what I went through, I have health insurance. I have a car. Like, these are not luxuries that we can all take for granted. It's difficult for some people to be able to jump through all those hoops so they can know for sure. That's why I'm saying these tests have to be mailed to us for free right now. Remember back in the 90s, we would get those AOL CDs for free in the mail all the time?
Yep.
Like, why can't this be like that?
I know. Hey, real quickly, 20 seconds. Fan wants to know, is a rapid CPR test as accurate as a lab CPR or PCR? 10 seconds.
I would say generally a PCR test is going to be pretty accurate, but when you're saying rapid, you might be referring to the rapid antigen, which is still pretty good, but not as sensitive as the PCR test.
All right. On TV, here we go. We are back with ABC 7 News special correspondent, Dr. Alok Patel. Before we jump in with more questions, you have another round of 2 truths and a lie for us.
I do, and I will not be as tricky this time, I promise.
Thank you.
Everyone out there knows the drill. Tell us which one of these is not true. Is it A, 270 doctors signed a letter urging Spotify to remove Joe Rogan's podcast due to misinformation? Or is it B, the CDC estimates about 60% of KF94s in the United States are counterfeit? Or is it C, urine therapy has been touted as a homeopathic remedy for many diseases, not just COVID, which is the reason it popped up in headlines last week?
All right. If you're watching us on Facebook, you know I'm going to need my help, your help again. I don't like to go 0 for 2, but I think A is correct. I think I've definitely heard about the urine therapy as a homeopathic, so that sounds true. I think even more than 60% of KN94s are possibly counterfeit. I'm tempted to go B, although my instincts have been really bad lately. So, Tom, you say B. Okay, Tessa says B. Wendy, C. Viet goes for a C, and he was correct last time. Okay, you know what? I was thinking B, but because Viet was so good about the last round, I went with C. I'm going to go with C. That's the lie.
Kristen, test taking 101 is you go with your instinct. The lie is, in fact, B.
See,
and
yes. Okay, I'm just having a bad luck today, bad luck round. But okay, go on.
So A is true. We can get into that if we want to go into more detail, but this just represents yet another clash between misinformation and what evidence-based recommendations really are, as Joe Rogan's incredibly popular podcast. The reason that B is not true is this is actually referring to KN95 masks, not the KF94s. And the KN95 mask is the one that I'll hold up right when we get off the screen. They're a lot more comfortable for most people than the N95. So a lot of people are running out to third-party sellers to buy these, but it's a lot of counterfeits out there. That doesn't mean that they're 0% protective. It just means that it may not be 95, which is what's advertised. And C is crazy. People have been drinking urine, urotherapy, urophagia, whatever you want to call it, for a long time. And it popped up on anti-vaccine websites as a way to cure COVID. But people out there, and you can read about this, will do anything from drinking it for autoimmune conditions, putting it on their skin. I even saw a report of someone using urine as eye drops to defeat eye redness. I cannot believe it. I mean, I can believe it, but I can't.
Yeah, I know. It's stunning. But I should have trusted my instincts. But congratulations to those of you who got B correct. That includes Brenda, who knew that it was KN95. All right. Vicky has a question. Oh, actually, she was saying about the government's website. You know, what about people who don't have a phone or a computer? Dr. Patel, correct me if I'm wrong, but I think they're setting up a hotline. They haven't given out the phone number yet. It's kind of a standby. We're doing it. But you're right. I wish all this would have come out sooner. A couple quick questions and headlines for today. Some information about marijuana possibly blocking COVID.
A couple friends of mine actually sent this to me, and it had me going down and reading the original study. So this actually, if you look at the actual headline, it talks about marijuana blocking COVID. But this is dangerous because this actually was just a study done in a lab, and it showed that a derivative from marijuana, a cannabinoid acid, was actually able to block SARS-CoV-2, the virus. But again, this is in a petri dish. You could put Drano or bleach in a petri dish and possibly block the activity. That doesn't mean it's going to work in an actual human in the real world. And this has been the danger throughout the pandemic is people seeing these lab headlines and then immediately trying to translate that into a real world scenario. Yeah. So early study, it's a derivative. It's not a pharmaceutical grade product. Be cautious.
And plus, sometimes people just read the headline and that's good enough for them. No, you got to.
Sometimes?
Yeah, right. You have to read the whole story and ask Dr. Patel. Also, I'm seeing there's a new study out of Scotland, I think, about the risk of COVID for pregnant women.
And essentially what the Scottish study was showing, and I'll just distill this down into a couple sentences, is that pregnant women, as we have known, are at increased risk from complications from COVID-19, and they're protected from the vaccine in multiple different ways in terms of premature labor. Your babies will get antibodies through the placenta, through breast milk, and the Scottish study just reaffirms what we've been telling people out here. And, you know, it's unfortunate that there's been so much misinformation and fear relating to pregnant women and getting the vaccine, and pregnant women having concerns about what it may do to their unborn babies. But guess what? It's perfectly safe in that population. And in fact, pregnancy itself is a high-risk medical condition. So it's very important that anyone pregnant out there chats with their doctor and gets the vaccine if you haven't already.
All right, Dr. Alok Patel, thank you so very much for joining us and testing us today on COVID headlines. By the way, many people here are saying, oh gosh, feel better soon, Dr. Patel, including fans. So you got a lot of fans out there. And so take care. See you soon.
Appreciate you all. I hope I don't sound as nasally as I did earlier.
A little bit, but you still sound super smart. All right, we'll be right back. All right, everybody, thank you for your participation today. Some great questions for Dr. Patel. And yeah, you all did really great on the 2 rounds of 2 truths today. So thank you very much for that. Hang on tight. We'll be back shortly with a really good interview that will hopefully shed some light on what's happening with the schools. Like, are they allowed to close, not allowed to close? What happens if they close if they're not allowed to close? Do they have to make up the days? What does this mean for your kid? So have your questions ready. Wellness days, PPE, hybrid learning, schools in the Bay Area are facing tough choices amid rising cases and staffing shortages. Joining us now to share what San Mateo County is doing and what state law actually allows, San Mateo County Superintendent of Schools, Nancy McGee. Nancy, thank you so much for joining us today. Really appreciate it.
Thank you for having me.
Yeah, absolutely. We have so many questions. We're seeing that some schools have shut down temporarily, some citing too many teachers are out, others citing too many cases among students. Meanwhile, there's a lot of confusion over whether the state has revised its rules and made allowances for remote learning. Has it or has it not?
It has not. There is no space in the law for to go straight distance learning. Schools have to go through a process called independent study in order to make that happen. So it can happen for up to 10 days, but there's a lot of paperwork and process you have to go through. It's not an automatic switch.
Are you saying that a school can just say, we want to move to independent and all our students agree to this, they're going to do it and then still get the funding for it? Is that something that can be done retroactively?
Well, there is a process for short-term independent study, which is 10 days. How that happens matters, is up to the individual school district. And in San Mateo County, where I am, all of our districts are very intent and committed to remaining open through the surge. So I can't really speak to how other counties are going about it, but they do have a mechanism through short-term independent study to temporarily go do a different kind of instructional program.
Okay. Now, I don't think that is what some of the school districts that have closed are doing. I could be wrong, but reading up on, Hayward Unified and Milpitas, which just declared today that they're going to do a temporary remote learning process. I'm not asking you to comment on other counties in particular, but if a school in your county came to you and said, I want to do that, would you tell them maybe you won't get paid for those days?
Well, I think it's all in the fine print. People use the term remote learning generously. And so you can accomplish independent study through different ways. One might be that you've got students doing a combination of paper packet work and also some hybrid learning online or accessing their Google Classroom. So it might not be look like the remote learning that we knew back in March of 2020. It could be a variety of different approaches. So I think the term gets used broadly and doesn't always mean what people think.
I think you're right about that. Sometimes people use them interchangeably, but I understand they are totally different. What we're familiar with last year was synchronize, like you're on Zoom at the same time as all your classmates and your teachers there instructing you via Zoom. It's classroom, but just online. This independent study is really nothing like that. That's why I'm asking you, are you aware of local school districts in the Bay Area that are just shutting down for a few days? Is that, as far as you know, what they're doing, moving to this different independent study, or are they just resuming what we had last year, which is the remote learning on Zoom?
I don't think too many school districts are resuming what we did last year. One option school districts have right now to manage the surge, and probably the reason they would close for a day or two or three would be because they have too many staff members out and can't operate the school safely. So you can add days to the other end of your calendar in June if you opted to close now for a number of days because of the emergency. And there's also a waiver process where school districts can apply to recover funding if they had to close and had no other option for safety reasons as far as not having enough adults on campus.
Do they have to prove that they didn't have enough adults and ran out of options? Because it seems like some of these districts, some cited not enough adults, but others are saying too many cases amongst the students, which I understand would not qualify actually as a legit reason to shut down temporarily, right?
Correct. There's a list of criteria you have to go through in order to determine that closing your school would be the last resort, that you've tried everything else and don't have any other options.
So if they didn't meet all those requirements and they acted on that without it being a last resort, is that possible that they may not get the money for those, student days?
Yeah, all the school districts are audited every single year, regardless of whether it's COVID or not COVID. So those things are all covered under the annual audit. And it's possible that a district may be penalized financially for not meeting all the standards. I don't know of specific instances where that's occurring.
Okay. Let's say a school district in your county wanted to do this. You mentioned the possibility of making up the days at the end of the calendar year. What are some other options? Like, could they lengthen the school day by, say, 10 minutes, 15 minutes a day for a while?
Yeah, they do have to make up the instructional minutes that add up to what calculates as a full academic school year. So adding minutes to the day would be one way. I think districts, that would take a long time to accomplish. So likely they would just add days to their calendar. And then the other way, of course, is to do a short-term independent study where you're making sure that you are accomplishing all of your academic objectives, whether that's through paper packets or through students working independently through their Google Classroom account. It might not mean that teacher is online teaching synchronously as you described.
Right.
But it would be a very short-term option.
Look, all these discussions are happening, Nancy, because there are a lot of cases out there in the community, a lot of testing positive. And, you know, to your credit, I know in your county there's a lot of testing available on campus. One of the districts under your supervision, though, the San Mateo Union High School District, has been tweeting that it's hiring substitutes, that it seems like the pay for substitutes has been raised from $235 to $375 a day. I think we have that tweet really trying to be enticing about it. Does that speak to a pretty dire situation in terms of the substitutes and staffing shortage? Talk to us about what's happening in your county.
Absolutely. I mean, it's not, in this case, it's not just in our county, it's all over the state of California and actually all over the country. All schools are we were already stretched for substitutes from August through December, but now with the Omicron surge, that has really doubled. So the urgency is dire, and districts raising the level of pay is a good solution to try and attract more people in. We have some, you might have noticed some school districts that are putting out calls to their parent community to apply to be emergency substitutes.
Yes, we've seen that. All right, Nancy McGee, thank you so much. Join us on Facebook Live to continue the conversation. Nancy, can you talk about what your county is doing to ensure that school districts have what they need in terms of N95 or KN95 masks and testing on campus?
Yeah, so the state just distributed a large allocation of N95 masks to every single county. We accepted our allotment on Wednesday, and so we will be our districts will be picking up their supply early next week. So everyone should be in pretty good shape on adult size N95 masks. The shortage is in the child size masks. And so that the state just came out with a solution for that today. So we are anticipating, again, another shipment of child size masks, perhaps by the end of next week.
Okay.
As far as testing resources go, we also received the state allotment of at-home test kits for when students were going to return after the holidays. So we dispersed that to all of our public school students the last week of December. And we're encouraging all of our districts to order the bulk supplies of rapid antigen tests where they can use them on campus in a professional setting to bring staff back when staff are entering back from isolation, or when students are returning back from isolation or quarantine, they would have the supplies at school to do that quick test to make sure they're safe to return to the classroom.
All right, Nancy, thank you so much. We only have about 20 seconds, but I do want to ask you, I thought only individual students can opt into independent study, but when these schools close like that, it sounds like they're going to find a way to say our whole school has moved to that. There is actually a way to do that. It doesn't have to be individual student opt-in. I think I'm going to email you about that because I've got to get the answer
That's right.
to
Yeah,
that.
why don't you do that? That's a more than 20 seconds.
Thank you so much. Really appreciate your time. Thank you so much for joining us today on this interactive show, Getting Answers. Today we cover more COVID-19 headlines, including the CDC's new updated guidance on masks, including cloth masks provide the least protection. It is okay now to buy N95 masks, and fit is paramount. We'll be here every weekday at 3 on air and on live stream answering your questions. Have a great day and a great weekend. Yeah, thanks everybody.